You're listening to Brunch with me, Noreen Mayer, on this Wednesday morning. Now, let's turn to our next topic and guest of today. In the next 20 minutes or so, we're chatting with Professor Siew Chien, who is an Associate Dean of Research and Professor in the Department of Medicine and Therapeutics. And she's also the Director of the Microbiota Eye Center at the Chinese University of Hong Kong. Now, Professor Siew is an internationally renowned clinical scientist in the gastrointestinal diseases and microbiome medicine. She's also at the forefront of epidemiology, genetics, pathogenesis, and the treatment of inflammatory bowel disease, IBD, in Asia Pacific and globally. And I'd like to welcome on the program Professor Ng. Thank you so much for joining us today.
Hi, Noreen. Good to see you again, and thank you for having me. Good morning to everyone.
Yes, it's so lovely to see you again. I should also mention that Professor Ng is also the recent recipient of the Bank of China Hong Kong BOCHK Science and Technology Innovation Prize 2024 for her groundbreaking work in the category of life and health. And the Bank of China Hong Kong Science and Technology Innovation Prize was established by the Hong Kong Alliance of Technology and Innovation and also sponsored by the Bank of China Hong Kong Limited, which is a non-governmental merit-based award. The Science and Technology Innovation Prize aims at rewarding outstanding scientists and research teams in Hong Kong or research-related institutions set up by Hong Kong higher education institutions and located in Guangdong, Hong Kong, Macau, Greater Bay Area for their significant achievement in scientific and technological innovation and transformation. So I'm really excited to be chatting with you, Professor Ng, because your research have been really groundbreaking, and we'll get to your research soon. But first of all, let's maybe talk about what this recognition means to you and also your work.
So I think this prize is pretty special, to me. I think for several reasons. I still remember when I first started working in the gut microbiome field, probably more than 10 years ago now. People were skeptical because the microbiome essentially just means all the microorganisms inside your gut. You can't see them. They are naked to your eye, but there are about 400 trillions of them. And we now know they are very powerful. So when we first proposed the gut microbiome is linked to a brain condition, a neurodevelopment condition like autism, people were like, no way, how could that be? How could the brain and the gut be connected? And I think it takes time. It was challenging to prove. And we are very, very pleased to say that, look, this is a real recognition to show the scientific community. We now know that the gut microbes control the brain, the stress level, the development of children, and we can do something about it because there's something that you can change, not like your DNA. So I think it's special because it's a lot of hard work. Not just me on a personal level, but also like 50 to 100 scientists that's working in our Microbiota Innovation Center, Magic at Science Park, to make this, dream come true. And I have to really say thank you to, the supporters like the Bank of China co-support with the Hong Kong Alliance of Technology and Innovation, and Professor Dennis Loh to actually spearhead this award just, 2 to 3 years ago to recognize and give more, I suppose, inspiration to young generation to think about pursuing science.
Yeah, I love how you also credit your team also, because it is, teamwork makes the dream work. And sometimes when you have a great team to create something, it goes a long way. Let's talk about your work in terms of identifying the microbial signatures in the inflammatory bowel disease and also the autism spectrum disorder. How did you discover that? How did that idea even come to you and your team?
Very interesting. I remember when I was doing my PhD in Imperial College in London a long time ago. So then I really started thinking, look, I remember seeing a young patient with bad inflammatory bowel disease, and he was only in his 20s, and he was having bleeding every day from the stool in the gut and going to the toilet 20 times a day with deep ulcers in the gut, a little bit like when we're sick, we have ulcers in the mouth, but imagine you have like 50 ulcers inside your gut. You can imagine how painful and how terrible that is. And he was not able to eat or drink. So he's really got a condition called inflammatory bowel disease. But we don't really know what causes it actually. And I was just working like at midnight in the laboratory, and one day I discovered, look, there's something inside the gut, not just the gut, but the microbes that's really abnormal. Like there are bed bugs that are in there that attack your own immune system. So we need to think of ways to rebalance that. And I think that's when I knew, wow, actually, they may be invisible, but they are pretty actually powerful. But I think in those days, the technology is not really here to do much. To look at the microbes, you need to grow them. So which means you have to grow them for weeks and weeks to make them come out. Now with all the next generation sequencing, we are now able to, out of the 40, trillions. Actually, another hobby I like just to sidetrack is to look at stars. I remember someone said, look, there are, 40, billion stars in the galaxy. Wait, but, there are about 10 to 20 times the number of bugs inside your gut. And we don't know all the names of the stars in the Milky Way. Neither do we know all the bugs inside our gut because we can't, have any technology to detect them. But now by our new technology, we can identify who they are, what they do, and what they're capable of doing to your body. So that's when I thought, look, let's use this new technology. And now we identify, for example, there are certain specific bacterial markers just by looking at your stool sample, a tiny little sample collected at home. We can say, look, you're at risk of having severe inflammation in the gut, or your child may have a increased risk of developing autism spectrum disorder or even ADHD, which I know after the pandemic, after what's going on in the society, is actually becoming increasing in numbers, not just in Hong Kong, but in global arena as well.
Yeah, you're absolutely right, Professor. Not just in children, but adults as well. We see a lot of later diagnosis also. I like the analogy you gave about the stars and the bugs. That can be a good title for a book as well, Stars and Bugs. You also developed a non-invasive test, which is based on the gut microbiota. What does that mean? And how do those tests, how are they different to the traditional methods of diagnostic tests?
Yeah, one of our missions really is to look in what's going on out there in the medical arena and ask, is there an unmet need? And if I look around, I think one of the largest unmet need is a lot of people are diagnosed or maybe detected with the conditions very late. And there's several reasons. So for example, with autism spectrum disorder, there's just really no one single test that can help you detect. And for a lot of parents, they'll be toying between, does my child have or do they not have? Because there are certain, slight symptoms that may appear to be the case. So the average waiting time can be as long as 18 months to actually get to see a psychiatrist or psychologist to detect that. And to me, the golden opportunity for really intervening to change, and help these children is the first 6 years of life, essentially, because by the time, like you said earlier on, we now have a lot of adults that may only now become apparent to have this condition, that it's very hard to treat them effectively. So the same for inflammatory bowel disease. So I think if you look around 10 people, maybe 3 or 4 probably say, I've got tummy upset, I have some gut problems. It's so common. It could be the food you eat, it could be the stress you have every day. But the real issue is this something serious? And we don't know, right? So now, I mean, we've transformed some of the very complicated technology into a technology where we can just, for example, collect one stool sample for someone at home. It can be sent to our laboratory. We use our AI generated technology, and I can then inform basically this individual what their risk is. And really that could help to streamline them to further investigation and maybe to have treatment earlier on. So it's kind of a bit more personalized, a bit more rapid. And I like the fact it's non-invasive because I think people don't like to have endoscopies and things stick up your bum very quickly or stay in the hospital taking the nasty bowel preparation to clear the bowel to have colonoscopy. So that's the unmet need I see this technology can serve.
Absolutely. And you're right about early intervention is key. And so sometimes it is that golden opportunity to diagnose these neurological diseases, especially for young children. What about the impact of gut microbiota on gastrointestinal diseases and also neurodevelopment conditions? Because we have heard that gut health and mind health is very much connected. What are your thoughts on that, Professor Ng?
I think it's so absolutely true. It's a bit like, the saying gut instinct, gut feeling, or you have butterflies in your stomach
Yes.
when you're nervous. And it's because basically what happens is there are a lot of good bacteria inside your gut, and they send signals to your brain, to your blood. So the happy hormone that makes us all very happy, we call it serotonin. Actually, 90% of it is released by your bugs inside your gut. And a lot of people may not know that actually. So now we know that if you look after your gut really well, actually you can probably sleep better, you can probably eat better, and you probably have a healthier and happier life, feel free of mental problems and sort of stress. And the reason is because they are connected in both ways. And I think the beauty of this is that you can do something about it, because when we talk about human DNA, a lot of things you inherited, people think we can't change that if you inherited a bad cancer gene, from that. But what we are looking now is looking at the DNA of our bugs. And these accounts for 99% of all your DNA in your body. So you're like a bit of super organisms. And I like the fact that you can modulate them by changing the microbes to rebalance them so that you can use it to treat conditions like maybe colon cancer in the future, to increase chemotherapy response, and even to help neurodevelopment condition like dementia. Maybe with age, right, you lose certain good parts, so we can replace it to help you delay this aging process. And we know Hong Kong has the longest, age population in the whole world, so we need to keep people healthy if they live so long.
Absolutely, because we often talk about sort of the health span, sorry, the lifespan, but it really is about the health span that we should also be looking at. I like that thinking. You can't control necessarily your own DNAs, but you can control the DNAs of the bugs that live in you. I really like that analogy. I'll remember that because we are what we eat. So sometimes if we are like a machine or whatever, if we put in good fuel, we'll operate in a more optimal manner. Let's talk about the Microbiota Eye Center. What sorts of initiatives are you currently working on as the director, and what would you like to explore further?
I think I have to say we really have to thank the Hong Kong SARS government and the Innovation Technology Bureau, because 5 years ago we were given this opportunity to build this center. And our first mission is really to use the microbiomes, the bugs inside your gut, to tackle common human diseases. So we started looking at inflammation, cancer, and now we are even looking to other mental health conditions like depression and also dementia. So I think one of the largest, direction really is to turn bugs into drugs. Because for a lot of people, when you say you're taking a drug, people worry about side effects and they don't want to be on the drug for maybe depression or certain mental problem. But now we can actually identify the bugs inside your gut, and it's natural. For most people, it lives inside you. And then we make it into what we call a live biotherapeutic, which is a drug. And that can be used to probably improve certain symptoms. For example, symptoms of people who may have cognitive decline with memory loss, or even children who are very sensitive. And we did certain studies and show that it can improve anxiety in children, or even very hypersensitive children, actually preschool or preschool age. So I think this is going to be one of the real future, of microbiome medicine, and what the Magic Center is inspiring to do.
Yeah, and looking into the future developments, and also what sorts of collaborations will you be doing in the future as well?
I now see the microbiome or the gut microbiome as a new specialty, as an organ on its own. So, we collaborated with like University of Chicago, University of Cambridge, and University of Melbourne as part of the Hong Kong initiative. But I think what's most interesting about the gut microbiome is actually cross-discipline, because now it's related to pretty much, almost every single disease you can think of. So we now know even with heart conditions, with skin conditions like allergies and eczema is also related to that, and with neurodevelopmental conditions as well. So we work with pediatricians, we work with obstetricians, we work with rheumatologists, we work with psychiatrists, and surgeons and cancer people, oncology. So it's one of those few that now I think is going to boom because of this, impact is going to sort of create, and to collaborate with industry. Hong Kong government as well, and different pharmaceutical company. So I think we think Hong Kong is in a prime position to have a microbiome ecosystem actually in the future, partly because, and then we can bring more talents here actually who wants to be part of this journey.
I can absolutely see that. Yeah, because nowadays we're seeing that stress is one thing. So you can work with the psychiatric department, and you mentioned rheumatology as well, because a lot of the times it's also triggered by stress. That's totally it's interdisciplinary indeed. What sorts of challenges can I ask, Professor Ng? Because a lot of times people will focus on the awards and the accolades, but behind the scenes, there have been a lot of trials and errors. What sorts of setbacks or challenges have you faced in your realm of research?
I think when you do research, out of the 10 experiments you do, probably, nine will likely so fail. But then it's a little bit like startups, 10 startups, one may be successful. But the question is, if you can be one that, works and be successful, I mean, that would make a big difference. So I started off as a doctor. I just want to see patients. Then I became a scientist because I thought, I can only see 20 patients a day. But if I discovered some scientific, discovery that can help a lot of people out there, then about 5 years ago, I thought, look, why not be an entrepreneur? So I opened a new company called Chien, and now we got a second one called MicroSig. And I thought, look, this is going to then bring our innovation and technology to the home of people, like, maybe one day Noreen, yourself, or my, family abroad somewhere else, and they can actually even have access to a technology that was discovered just in the laboratory in magic. And I think this is what society impact is all about. So, but the challenges is really, I think, to just keep going. We now need to protect all your technology. So IP is very important. And I think Hong Kong has good healthcare system to help us, do big clinical trials to prove that it works.
Yeah. How do you have all the hours in the day? You're a scientist, you're an educator, you're an entrepreneur, you're a researcher. Professor, Ng, hats on, indeed. And part of it is also nurturing the younger generation, in which you do so in your field of education. What advice do you have for young researchers or students who are interested in pursuing a career in science, in microbiome research, or biotechnology?
I believe actually there's no better time than now actually to embark on this. I think timing is everything in life. And I think it's really truly a golden opportunity, partly because we're having so much support from every single, angle. So I think for a young, news researcher, I would say, I benefited from a lot of my mentors that giants, people I've stand on the shoulders, like Professor Joseph Silver and Francis Chien, a lot of my mentors who are leaders in the field. And I think always find, a mentor, maybe a few mentors, and then adapt your own way of doing things and be sort of creative. I can say as a women, leader, I would say the three C's: be creative, for example, be compassionate and be competent in what you do. And then I think eventually probably would happen at some point.
I think you've just given the best advice, and not just for your students, but I think for people in general in pursuing something greater in their life. Professor Ng, congratulations on winning this award. We're so pleased for you, and I look forward to inviting you back again. Professor Ng is a recent recipient of the Bank of China Hong Kong Science and Technology Innovation Prize 2024 for her groundbreaking work in 2024 in the category of life and health. And Professor Ng is also the Associate Dean of Research and the Professor of Department of Medicine and Therapeutics from the Chinese University of Hong Kong. Thank you so much for joining us today.
Thank you for having me, Noreen.